Welcome to our fertility show, the fertility clinic with Gerald Massa, the health educator. I welcome you, my friend, for this show. And today, I'm really so sorry I've delayed by a few minutes, but I'm really so happy to be here with you today. And yes, on this channel, we do talk about fertility. We answer your questions about fertility. We do create awareness about fertility and reproductive health. So in today's question, we are answering some 3 questions from our viewers. Remember, you can also ask your question in case you have that one question that has been disturbing you and you'd like to know, you'd like to get answers from the expert. On this show, we do answer all your questions. So the first question is about clomiphene, and one of our viewers asked and said that she took clomiphene in her first cycle, and then she also took duphaston, and she's asking herself, why is she not getting her periods? Why is she not getting pregnant? She's asking herself, she has done the tests, but the tests are showing that she's not pregnant. She took clomiphene, that is chromate, and then she also took duphaston. One thing we shall begin by addressing here is that you should not always self-medicate yourself. You should always talk to your doctor, who should be the one to prescribe you your medication. Do not self-medicate. You should not self-medicate yourself. So we are saying that she took clomiphene and then she also took duphaston, and she's asking herself what could be causing this, what could be causing her not to see her periods. Now, we shall first of all understand that clomiphene specifically is a drug that is used in women who would like to get pregnant. What it does, it actually stimulates ovulation. It stimulates ovulation. Ovulation is the release of a mature egg on the 14th day. Now, when the egg has been released on the 14th day, what is going to happen is that it will actually enable you to increase your chances of getting pregnant. So one thing you should know is that you should not take clomiphene, or you should not take clomiphene by you yourself prescribing it. Self-medication is not good. You should always see your doctor, who will prescribe you these drugs, who will prescribe you the clomiphene after doing some tests. Now, talking about the tests which can be done when you are to take clomiphene, your doctor will do some tests, including the pelvic ultrasound scan, and then also your doctor will also most likely include other tests like the hysterosalpingogram. So when our friend took clomiphene and then she also took duphaston. Duphaston specifically is a drug which contains progesterone. It actually contains an active ingredient known as dihydrogesterone. So it is a type of progesterone which also actually plays a very big part in helping you to get pregnant. But remember, if you take clomiphene and you take duphaston, and at the same time you do not see your periods, you should actually check with your doctor, who will do some tests, to confirm what could be happening with you. So on this show, we do answer your questions about fertility and reproductive health live. If you have a question about fertility, if you have that question you would like to ask about fertility, kindly go down in the comments and please kindly ask your questions, and I will be able to answer your questions. Yes, hello, Nakabuye Christine, I can see you. You are most welcome to our show today, Nakabuye Christine. Zanyusenyo Okulaba, thanks a lot for keeping time, and thanks a lot. Tell more friends to come for our live shows. We always talk about fertility, beginning at exactly 5 p.m. So, Nakabuye Christine, you're so welcome, and remember, this is a live show where we can interact and have all your questions answered. Ask me all your questions, and I will also ask you some few questions. I'm also ready to learn from you, as you are also ready to learn from me. We are answering a question that has been asked by one of our viewers, who said that she took clomiphene and then she also took duphaston, and then she's not seeing her periods, and yet at the same time she's not actually pregnant. So we've said that when you take clomiphene, the most important thing we need to note is that clomiphene specifically helps with ovulation. it helps stimulate ovulation, whereas duphaston specifically, it basically increases your progesterone levels because duphaston contains progesterone, so it basically increases your progesterone levels. Progesterone is a very important hormone which helps you to actually have increased chances of getting pregnant, because when you get pregnant, I mean when you're looking at getting pregnant, the progesterone levels in your body should be high. If the progesterone levels are low, then there are high chances that you could end up with miscarriages. And actually, women with repeated miscarriages, when you go ahead and have your doctor do some tests, there are high chances that you may discover that you could be having low progesterone levels. Mu video yaffe ne yaleero tuli kuddamu ebibuuzo byaffe ffenna ffenna. Ebibuuzo ebyabuuziddwa mikwano gyaffe ku WhatsApp na wano ku YouTube. Ekibuuzo ekisooka kiri nti mukwano gwaffe yabuuziza nti abadde okay then, just know that I love you so much. Thanks a lot, Nakabuye Christine. I love you too. And thanks a lot for the support. Thanks for watching our shows. And I also really, really appreciate the fact you are also saying that you teach also eye effects. Could you be more precise, Christine? You are asking that do I teach eye effects? You try to specify exactly what you're meaning, whether you mean that do I also handle topics of eyes. Yeah, if you are asking that do I also handle topics of eyes, yes. On a superficial note, I do also handle, I also can answer your questions in regards to issues with your eyes. If you have issues with your eyes, allergies, infections, I can advise. But still, if at all something is very complex, then I can always advise that you may need to see an eye specialist, also known as an ophthalmologist who will go ahead and do more complicated or more complex tests on your eyes. But if it is simple allergies, simple infections, these we can actually advise on what you need to do, because the commonest issues with eyes is that you could either be having conditions like allergic conditions, for example, allergic conjunctivitis, or iritis, that is inflammation of your iris, and something in related to that. So if at all you have any questions, please let me know. We are proceeding with today's topic, and this is the live fertility clinic with Gerald Massa, the health educator. Now, the next question that was asked by our viewer was that she took paracetamol. She's asking, if you take paracetamol, can you actually have increased chances of getting pregnant? Now, paracetamol is a drug. It is an antipyretic. In simple terms, it's a drug which brings down your temperature. It brings down your temperature. It also blocks the those pathways. It blocks those pathways, also known as the pain pathways, or it blocks pain. It is used in management of pain and then also in bringing down your temperature. When your temperature is very high, normally you will be advised to take some Panadols or paracetamol. There's no way paracetamol is connected to pregnancy. So if your question is that how can paracetamol increase your chances of getting pregnant? Please, paracetamol or Panadol, it does not have any effect on your chances of getting pregnant. Mu video yaffe eyaleero mu session yaffe omusomo gwaffe ogwaleero tuli kuddamu ebibuuzo ebibuuziddwa mikwano gyaffe, era ekibuuzo ekisoose kibadde kiri ku clomiphene ne duphaston. N'agamba nti akozesezza clomiphene ate tali kufuna lubuto, tali kulaba na periods ze. Ne tugamba nti clomiphene ne duphaston biyinza okubanga kwegamba byebirividdeko okubanga talaba periods ze, kuba bikola kye tuyita hormonal imbalances oba bikozeseza mu bungi. So clomiphene ly'eddagala erikozesebwa mu bakyala abagala okufuna embuto, naye tugambye nti obwera olina okusooka n'olaba dokita wo oba omusawo wo n'abanga yakuwandiikira eddagala lino, tolina kulyewandiikira, tolina kulimira gwe kennyini nga gwe. So fertility education with Gerald Massa, the health educator. Yes, that's what we are covering today. We are answering your questions. The next question is about chromate for more than 6 cycles. Okay, then the next question is that one of our viewers is asking that chromate for more than 6 cycles. Can you take chromate for more than 6 cycles? Now, we've talked about chromate. previously, and we've just talked about chlomid. We've said that chlomid is a drug that is used by women, or that is prescribed to women who are trying to get pregnant. Specifically, what it does, it stimulates ovulation. In other words, it stimulates the release of a mature egg on the 14th day, thereby helping a woman have increased chances of getting pregnant. But if chlomid is used in excess, if you do self-medicate yourself on chlomid and you do not follow what your doctor advised you to do, then there are high chances that you could end up with issues. There are high chances that you could end up with conditions like ovarian hyperstimulation disorder, which is evidenced by a woman having large swellings or large masses on their ovaries. So the question is, can you take chlomid for more than 6 cycles? The answer is that you should not take chlomid for more than 6 cycles. You should not self-medicate yourself on chlomid. You should always follow what your doctor tells you. Ideally, chlomid is supposed to be taken, at least you take 1 tablet per day for 5 days. You take 1 tablet per day for 5 days, assuming that your doctor has advised you to take chlomid. Do not go to the pharmacy and self-medicate yourself. So when do you take chlomid specifically? Let's say you are trying to get pregnant. When are you going to be taking chlomid? If you see your periods today, you see your periods tomorrow, and then also the next day you see your periods. What you need to do is that you have to wait for your periods to be over, to stop. When the periods have stopped, you count 3 days. You say today is day 1 without you seeing your periods. Next day, day 2, and then the following day is day 3. After stopping your periods, then you will be able to actually begin on chlomid. So you take chlomid 3 days after stopping your periods. The main reason is that the menstrual cycle has 2 phases. It has the first part of the 2 weeks, which is known as the follicular phase, and then the next part of the menstrual cycle is what we call the luteal phase. So specifically, we always advise that you begin on chlomid 3 days after stopping your periods, because we want you to take this chlomid when you are in your follicular phase, when the eggs are still growing, when they are still in that early stage, also known as the primordial phase or the primordial stage. So please, if you are to take chlomid, make sure that first of all, you consult your doctor, and then afterwards, you should also be able to make sure that you take it on day, specifically on day 3 after stopping your periods. So your next question by one of our viewers, Nakabuye Christine, thank you for the question. And the question is that, who are the people supposed to take clomiphene citrate tablets, and also those who are not supposed? Very good question, our friend Nakabuye Christine. We are asking that who are the people who are supposed to take. The question is here. Yes, you are asking that who are the people who are supposed to take clomiphene citrate, and who are those people who are not supposed to take. So the question is that who are the people supposed to take clomiphene, and then who are those who are supposed not to take clomiphene? Thanks a lot, Christine Nakabuye. And the first thing we should understand here is that clomiphene citrate is a drug. Just like any other drug, if you do misuse it, if you actually self-medicate on it, there are high chances that it can cause side effects. So the people who are supposed to take clomiphene citrate specifically are those people who are trying to get pregnant. That's the first answer. Any woman who is trying, basically this is a drug for women. Please, men who are trying to make their wives pregnant, you should not take clomiphene. It has other effects on your hormones, which we shall discuss in our following sessions. You actually should subscribe so that you do not miss these sessions we release here every day on fertility. So women who are trying to get pregnant, they are the ones who are supposed to take clomiphene. And then the other thing is that before you take clomiphene, before you take chlomid, you should make sure that you have some tests done on you. Your doctor will advise you on which tests need to be done. Most specifically, you will do what we call a pelvic ultrasound scan. Your doctor will do what we call a pelvic ultrasound scan. And then after doing this pelvic ultrasound scan, your doctor will be able to establish whether your fallopian tubes are okay, whether the inside of your womb, the inside of your uterus is normal, or you have some issues. And then also your doctor will establish whether you have ovaries which are functional, ovaries which are normal, which are not having any issues. So the second answer to this question, who are the people supposed to take clomiphene? Those people who do not have any swellings on their ovaries or any swellings in their reproductive system. If you are a woman and you have swellings, you have cysts, you have masses, you have ovarian cysts, please, you are not supposed to take clomid. You are not supposed to take clomiphene citrate. The main reason is that there are high chances of you actually having these masses increase. They may increase so much, and this may actually have a hazardous effect because these cysts can actually end up rupturing or bursting. And when they rupture, they can actually put you in a fetal condition. So the next group, the next type of person who is supposed to take clomid is someone who has a normal reproductive system with no ovarian cysts, with no swellings, or with no other masses which are present. For example, fibroids or leiomyomas. If you have fibroids, if you have leiomyomas in your womb, then there are high chances that clomiphene may actually worsen your condition. So I hope, Christine, you've got your answer. The people who are supposed to take clomiphene, and then the people who are not supposed to take clomiphene. And then, of course, if a person has other conditions, for example, high blood pressure, and then also other conditions like diabetes, you should actually have your doctor assess you, do the tests on you before before you proceed to go on medication prescribed by your doctor. So, next question asked by our friend Nakabuye Christine. Thanks a lot for the questions, Nakabuye Christine. Keep them coming. I'm here and I'm ready to answer all your questions. Next question is that, what are the side effects of taking clomiphene? What are the side effects of taking clomiphene? We've just talked about this, Nakabuye Christine, our friend. We've said that okay, what are the side effects of taking? Okay, we've said that clomiphene citrate, the most important point we need to take from this point is that if you are a lady and you overdose yourself, or if you take clomiphene citrate for a long period of time, let's say clomiphene is supposed to be actually given for a maximum of 3 cycles. You can actually even read the leaflet inside the box of the clomiphene. The manufacturer advises that you should take for a maximum of 3 cycles, and in between each cycle, you should at least have some resting period of at least 1 or 2 months. So if you take your clomiphene this month, and then pregnancy does not happen, you should not take immediately, at least wait for 1 month and then repeat again. And then, of course, if it doesn't work, wait for at least 2 months and then repeat again. But if at all it doesn't work for a maximum period of 3 cycles, then you should stop, have some rest, at least of 6 months or even 1 year, depending on your condition. Remember, as you're waiting to take your next cycle of clomiphene, you should have the pelvic ultrasound scan done. Why? We want to discover, or we want to rule out presence of masses or cysts or any changes in your womb. So what are the side effects of taking clomiphene? The side effects of taking clomiphene are that if you take a high dose, for example, you are supposed to take 50 milligrams of clomiphene, well, that is 1 tablet per day for 5 days. And then you take 100 milligrams, those are 2 tablets of clomiphene per day, maybe for even more than 5 days. Remember, what clomiphene does in your system is that when you take it, it actually raises your LH levels. It raises the levels of the luteinizing hormone. When the luteinizing hormone rises, remember it is a hormone which is very, very important in helping or in bringing about ovulation or the release of a mature egg. So when the LH levels rise, then ovulation is going to happen on the 14th day. We know that day, we've talked about that on our channel. If you've missed, you can go through our channel and then you watch our videos about ovulation. I've put out lots of videos about ovulation. You can still ask your questions and I will be able to answer. So the first side effect of clomiphene is that when you overtake it, you are actually most likely going to end up with what we call ovarian hyperstimulation disorder. The first side effect of clomiphene citrate is that you are most likely going to end up with what we call ovarian hyperstimulation disorder. This is when your ovaries will begin developing big swellings or big masses, and these swellings can actually rupture or they can burst. And when they do burst, you can actually be in a fetal condition. Your life, it can actually be life-threatening. And that's why we are saying that please, please do not self-medicate. Always, always work hand in hand with your doctor, your specialist, your endocrinologist, your gynecologist. Follow what they tell you, because at the end of the day, if you take these drugs and they put you through conditions, they put you through these complex conditions, then it's really not good, because it can actually put you at risk. So do not self-medicate. Make sure that before you take chromate, you should have the tests done on you. You should have a pelvic ultrasound scan done on you, plus maybe a fertility hormonal screen test. Your doctor may decide to look at your LH levels, because ideally you're taking chromate for you to, the main reason you're taking chromate is to have your LH levels rise. So if your doctor does the LH level test during ovulation, they take your blood and they look for the luteinizing hormone levels. And during ovulation, the LH levels show that you have actually very normal LH levels. And then you may not need chromate. You may just need something as simple as folic acid, or something as simple as vitamin B complex to actually increase your chances of getting pregnant. So that is the answer to that. I hope Nakabuye Christine, you've got your answer. Remember, keep the questions coming in. I'm right here. And thanks a lot for watching. If you've stayed with us for this while, I'm really so thankful to you. I'm really so thankful to you for sparing some time to attend our fertility live clinic. So next question, you can also ask your questions just like Christine is asking. The next question from Nakabuye. Nakabuye Christine is this: can I take clomiphene citrate tablets minus checking on the doctor? So as I would like to increase or my ovulation to get twins, can I take clomiphene citrate tablets minus checking on the doctor? That's what I've just talked about. You should not take your clomiphene. You should not take any drug minus checking with your doctor. The main reason is that if things go bad, if things actually do not work out and maybe you get issues or you get serious side effects, then still you, at the end of it all, you will again run to the doctor, and then the doctor will ask you, what happened? Who prescribed you the clomiphene? Why did you take clomiphene without checking, without having an ultrasound scan? Why did you take the clomiphene when you are already ovulating very well? So you may be taking something when you are really not, when you do not need it. Christine, take an example of someone who actually does not have high blood pressure, and then they are busy taking the pressure drugs, the amlodipine, the nifedipine, the losartan H, the amlozan, and all those amlodexs. You're taking the antihypertensive drugs, but you do not have high blood pressure. What are those drugs going to do to your body? You're taking antidiabetics. You do not have diabetes and you're taking antidiabetics. You're taking anti-HIV drugs. You do not have HIV, but you're taking anti-HIV drugs. I mean, antivirals. Why are you taking them? They're going to have an effect on your kidneys. They're going to have an effect on your liver. So it is very, very important, before you take your chromate, before you take any fertility medication, you should actually, first of all, consult your doctor. You should talk to your doctor, who will actually advise you on how much of chlomid you should take. So to answer your question, can I take clomiphene citrate tablets minus checking on the doctor? Please, you should not take your clomiphene citrate without confirming with the doctor. Make sure that you confirm with your doctor before you take your clomiphene citrate. So thanks a lot, Christine. Keep the questions coming. And I'm encouraging all of you out there, if you also do have questions about fertility, just like Christine, go ahead and ask your question. And this is a session. It is a live session where we do talk about fertility. We shall be able to discuss your questions right here. So next question is, if I want to visit you on the hospital, where can I find you? Okay, Christine, if you are in Uganda, because I'm streaming live from Uganda, we are actually around. I'm actually around, and given the fact that I do work in several facilities, but we can always set up an appointment, and then we can always meet at my private facility, and then we shall be able to interact more. So my WhatsApp number, let me see if at all we can display it. My WhatsApp number is +256 701 7978 and 76. My WhatsApp number is +256 701 7978 76. You can WhatsApp me, and then we can discuss more, and then we can put up a schedule. But I'm always around at beginning from 2 onwards up to around 6. So you can WhatsApp me, and then I'll be able to direct you. But I do also work in several facilities. If you would like to meet me at all the facilities I work in, we can still talk more on my WhatsApp. So Christine, WhatsApp me, and then we shall put up a schedule on how we can meet and then interact more about fertility, about reproductive health. I welcome you on our channel. If it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. On this channel, we do create awareness about fertility and reproductive health. So next question is, what is the best family planning? What is the best family planning to a person having blood group O? What is the best family planning? Okay, then the question is right there. What is the best family planning to a person having blood group O? Now, thanks a lot, Christine. Thanks a lot for the question once again. And you are talking about family planning, and then you are talking about a person having blood group O. One thing we should take from this question is that our friend Christine is asking about the best family planning, and then which best family planning is specific for that person who has blood group O. Now, when we are looking at the different types or at the different blood groups, there's no way blood group is related to family planning. Family planning, as the name suggests, family and then planning. You should actually have a family, first of all, and then you should plan for the family. And when you are planning for the family, you actually should look at the different family planning methods. If you visit a nearby family planning clinic, any clinic with that flower of a rainbow, you can always discuss more with the family planning staff there. But briefly, there are several family planning methods, and the first one, or the first family planning methods, are those ones which involve use of combined oral contraceptives. And then there are those family planning methods which involve use of non-combined or single oral contraceptive methods. For example, family planning methods like the POPs, those containing the progestin-only pills. The progestin-only pills, actually, they do have single oral contraceptives. So specifically, depending on how long you would like to plan for your family, or how long you would like to take before getting pregnant again, when you discuss this with your family planning provider, they will be able to advise accordingly. They will be able to advise whether you should actually get one which is for maybe 1 year or 3 months or anything. But remember, every family planning provider, what they will do, specifically, they will actually show you all the family planning methods. When you go to the clinic, they will show you all the family planning methods. they will tell you about each. They will tell you that there's the IUD, the intrauterine contraceptive device, which actually is inserted into your private parts, and it sits just at the top of your cervix inside your endometrium, and then they tell you how long it is supposed to last to actually provide its value, and then they'll even tell you about other contraceptive methods like the pills, and then they'll also tell you about the injections. They will tell you about the condoms. They will tell you about the calculator method. They will tell you about how you can actually have family planning by use of methods like withdrawal, by use of what we call basal body temperature, and then they will actually enlighten you on the different family planning methods. Now, remember, they will not decide for you. They will not decide for you that you use this or you use this. Specifically, you are the one to decide which family planning method is the best. So the question is, what is the best family planning method to a person having blood group O? The best is that you have to actually look at how long would you like to have this family planning method, and then look at the side effects, and then afterwards make an informed decision. It's always advisable that you actually involve your partner when you are talking about family planning. So always make sure that you involve your partner. And before I forget, whenever you are looking at family planning, there are two key things you need to note. The first one is that you should actually have your blood pressure checked. You should have your blood pressure checked. When your blood pressure is checked, it will be very easy for the doctors, for the nurses to know whether you qualify for a particular family planning method or not. If you have high blood pressure, you will not actually qualify for many of the family planning methods. For example, the injection or the injector plan. Nowadays, there are several brands on the market, but specifically, the active ingredient in the injection is called Depo-Provera. If you actually have high blood pressure, you will not qualify for the Depo-Provera because there are high chances that it will increase or it will lead to increased high blood pressure and other complications which may not be good. So what your family planning provider will do, they will check your body weight, and then they will check your blood pressure. They will tell you about the different family planning methods, and then you are the one to choose which one works for you, which one you would like to actually use. So about that, this is my answer. Remember, if you have any more questions, you can ask. I'll be able to answer all your questions. I'm right here, and remember, you can ask me all your questions. Thanks a lot, Nakabuye Christine. You've been very active. I'm really so humbled, and I'm so happy that you've stayed with us this while and you've asked all your questions. You are saying that, thanks so much, doctor. I'm really so humbled by your kind remarks. And remember, you can always ask me all your questions, and I will be able to answer all your questions. So we are moving on. We are moving on with our live stream. We are moving on with our live stream. Okay then, so I hope you've got something from today's live stream. Let me translate for our friends who may not understand English, who may not, who may be very conversant or well conversant with Luganda, and specifically twadde tuli kwogera ku ebikwatagana n'ebyokuzaala era tubadde tuligamba nti tuli kuddamu ebibuuzo bingi nnyo. Mukwano gwaffe abadde alina byabuuza, Christine abadde ali kubuuza ku bintu bingi, abuuzizza ku kye tuyita ekya family planning, ne tugamba nti family planning olina okumakinga sure nti akola ku family planning, omusawo wa family planning ajja kuba akubuulira types ki eza family planning eziriwo, and then afterwards gwe kennyini ojja kuba osalawo okulaba nga family planning ki gy'oba okozesa, naye ng'atejjukira musawo si alina okuba nga akusalirawo family planning ki gy'olina okozesa. And then mukwano gwaffe era abuuza n'agamba nti bantu ki abalina okuba nga bakozesa clomiphene citrate, ate n'ekirala n'abuuza n'agamba nti bantu ki abatalina kukozesa clomiphene, era ne tugamba nti abantu abagezaako okufuna olubuto be balina okukozesa lino eddagala erya clomiphene, naye nga tugambye nti nga tonafuna ddagala lyonna olina okumakinga sure nti olaba dokita wo n'aba nga akubuulira ki kyennyini ekiba kyetaagisa, oba kulwaki oba olina okukosa clomiphene n'akola tests ezo n'akunnyonnyola. So abuuziza ekibuuzo ekirala n'agamba nti what are the side effects? Okay, then n'abuuza n'agamba nti clomiphene ng'eddagala ery'abakyala abagezaako okufuna embuto likola buzibu ki ku mukyala wabanga alikozeseza bubi. Ne tugamba nti clomiphene asobola okuleetera amagi okuzimba kye tuyita ovarian hyperstimulation. So ku channel yaffe eno Gerald Massa the health educator twogera ku zino ensonga era buli lunaku ku ssaawa 11 mba kwendinga ndi live mba nziramu ebibuuzo byammwe era oba oyagala ekibuuzo kyo mbeere nga nkikola mu video oba mbeere nga kyentandikirako enkya mbadde nsaba kiteeke mu comments then nja kuba ntandikira ku kibuuzo ekyo tubeere nga twongera okuwayamukko. Amanya gange nze omusawo Gerald Massa era nsanyuse nnyo okubanga mbawuliza. Remember to subscribe so that you do not miss new videos we release every day about fertility and reproductive health. So, okay then, before I sign out, there's another question coming in from our good friend, Nakawiya Christine. So humbled that you are still with us. And yeah, tell more friends about our channel. Tell them that every day at exactly 5 p.m., we have a live session with Gerard, the health educator, and we discuss fertility. We answer all your questions. You've done all those tests, you've done the scan, ultrasound scans, and you want interpretation. Just come here at exactly 5 p.m., go to your phone, tune in on our channel, Gerald Massa, the health educator, and I will be live here discussing all this together with our good friend, Christine Nakabuye. And Nakabuye, you're going to be our assistant so that we can work together and then pass on this knowledge to many people who need this knowledge, who may not be able to access this knowledge. So I'm really so humbled, Christine, by your questions, and I'm so thankful that you're still here. So next question is this: how can I calculate my safe days, which are irregular? I have tried but failed to have the best results. Okay then, so Christine, the first question I will ask, though it's not good to reply a question with a question, but the first question I'll ask is this. You are saying that you have irregular periods. When you have irregular periods, it means that when you see your periods today, next month you may not be able to see, and then you will see it the following month. Basically, the periods alternate. That's what I understand by irregular periods. Or you see your periods today, tomorrow you don't see, then you see them the next day. What brings about this? Hormonal imbalances. Hormonal imbalances. When we talk about hormonal imbalances, specifically we are talking about estrogen and progesterone. There are other hormones like the follicle-stimulating hormone and the luteinizing hormone, which are produced in your anterior pituitary gland, a small part in your brain, which plays a very important function in producing these two hormones, FSH and LH. But the key hormones, when we talk about periods, we look at the end products of these two hormones, the FSH and LH, that is estrogen and progesterone. If they are not balancing, estrogen is supposed to drop. That is when you've not got pregnant. Estrogen hormone is supposed to drop. When it drops, then you're going to see your periods. The inside of your womb, the endometrium is going to degrade. It's going to shed, just like you can see a hill shedding as a result of water flowing all the time. So your inside of your womb is going to degrade and then it's going to be shed in form of periods. What you see as your periods, it is the endometrium which is shedding. The main reason is because you did not get pregnant. If you get pregnant, what happens is that progesterone is going to rise and even the estrogen will actually continue rising. But the most important hormone here is that progesterone will rise. It's also a hormone, by the way. And when it keeps rising, then it means that you are actually pregnant. Question is this: how can I calculate my safe days, which are irregular? I have tried to but failed to get them. Okay then. So what happens is that for women who have an irregular menstrual cycle, what you need to do is on that particular month when you have a regular, when you see your periods, because you do not know whether next month you'll see your periods or not, just pick out 1 month when you'll see your period, when you've seen your periods, and then actually subtract 14 days from that month. If at all you've seen your periods for maybe you've seen your periods for 2 or 3 days, and then basically subtract 14 days, what you get is the day of ovulation. So the question was, how can I calculate my safe days, which are irregular? Okay then, so ovulation is when the egg is released, is when you are most likely to get pregnant. Your safe days are when you see your periods, those days of your periods, and then also depending on your fertility levels. But your safe days are when you see your periods, okay? Those days of your periods, when you're in your periods, there's no way you'll get pregnant. Although according to research, they say that there are some women who can actually go ahead and get pregnant when they are in their periods. But remember, it's just a small group of a few women who are very, very fertile. But mostly what happens is that when a woman is in her periods, there are high chances that she actually will not get pregnant. So how can you calculate your safe days? Your safe days are those days when you're in your periods. And then also we can add on at least 5 days when you've just finished your periods. But there are women who are so fertile that even on the 50th day, they are actually at a high risk, or they are at a high chance of getting pregnant. So for an irregular menstrual cycle, you simply subtract 14 days, and then you'll be able to actually get the days of ovulation. To get your safe days, count those days when you are in your periods. Specifically, those are your safe days, plus maybe 4 or 5 days immediately after your periods. Nakabia Christine, thanks a lot for the question, and it's really a nice question. I'm going to actually have more on this question. We might actually do a video on this. How can I calculate my safe days? Yeah, it's a fantastic question. And then next question you are asking is that, note that please, doctor, I keep on changing the days every month. Okay then, so as we were saying, Christine, as we were saying is that what I was saying actually was that women with irregular menstrual, with an irregular menstrual cycle, normally they actually keep on changing the days. The main fact that you are changing your days, you are supposed to see your periods today, next month you actually see your periods on another day, then still that is a definition of irregular periods. But before we go on calculating your safe days and your danger days, it's always advisable that you begin with identifying what is causing the irregularity, what is making your periods to be irregular. So make sure that you do a pelvic ultrasound scan, and then also make sure that you have a fertility hormonal screen test. Your doctor will advise you on this. Your doctor will advise you on this, and then you'll be able to see your hormones, how they are, whether they are balancing or they are not balancing. If you do not see your periods on a regular cycle, then it means that your periods or your hormones may not be balancing. Next question by Christine. Yes, Christine, thanks a lot. Is that if I had it on 22nd and the next month can be 15th. Okay then, 22nd, that is when when the month is about to end, and then you had your periods on 22nd. Okay, you had your periods on 22nd, and then the next month it can be 15. Oh, okay, then I get your point, Christine. You may see your periods on 22nd, like 22nd of this month, and then the following month you're expecting to see your periods on 22nd again, you see them on 15th. That is the true definition of irregularity. That's the true definition of an irregular menstrual cycle, of an irregular cycle. So make sure that you do some checkups. You can get the medications to balance your hormones. You can get the medications to put you into your periods. But the most important thing, like I always advise our friends, is that you should begin by doing some checkups. You should begin by identifying what is causing the irregularity. What is causing the irregularity? Make sure that you look at your hormones and then do a pelvic ultrasound scan. So thanks a lot for staying with us, Nakabia Christine, plus everyone who is viewing in. Remember, you can ask your questions and I will be able to answer your questions. And I hope, Nakabia Christine, I've answered your questions. If you have any more questions, you can connect with me on my WhatsApp. May God bless and protect us all. On this channel, Gerald Massa, the Health Educator, we do create awareness about fertility and reproductive health. Ask me all your questions and I will answer your questions. Ring the bell, subscribe, like our videos so that YouTube will be able to show more people, more friends who need this information, but they may not know that we are here on this very site. So make sure that you subscribe and then spread the word. Share these videos on your social media platforms and we shall be able to reach more friends and they will also be able to get this information about fertility and reproductive health. So Let me translate a bit. Mukwano gwaffe Nakabuye Christine abadde abuuziza n'agamba nti periods ze ziri irregular. Ki ekireeta periods ze okuba nga ziri irregular? Tugambye nti ekireetera periods ze okuba nga ziri irregular kwe kuba nti yandiba ng'alina kye bayita hormonal imbalancing. Hormones ze bwe ziba tezibalansinga, then kyekiviirako periods ze obutaba nga ziri irregular. So the first reason why you may be seeing irregular periods is that your hormones may not be balancing. God bless you for me. Yes, God bless you too, Christian, and may God bless us all. And thanks a lot for attending today's live session. I'm signing out, and tomorrow at exactly 5 p.m. by the grace of God, we shall be here again talking about fertility, live fertility clinic with Gerald Massa, the health educator. See you and thanks a lot. Greetings, Nakabuye Christine. Greetings to everyone. Greetings to my family. Greetings to my friends. And keep the love, keep the positive energy flowing. See you tomorrow at exactly 5 p.m. We shall be live. We shall be talking about fertility and reproductive health. Tell a friend, come with a friend tomorrow, and we shall talk more. Bye-bye, and may God bless and protect us all. Bye-bye.